There are very few truly new infectious diseases that we can say in 30 years we've gone from incurable and essentially uniformly fatal to successfully treatable and largely, but not entirely, preventable. To me, one of the really great tragedies is that when we look at where HIV is still spreading, where there are new infections and the rates of new infections are unacceptably high, this is among men who have sex with men, gay men, transgender persons, and that is the unresolved component of the global AIDS epidemic. And that is an enormous amount of undone work, and that's part of why amfAR's initiative, the GMT Initiative, is so critical. Because unless we can really reach everybody who needs these services, we're not going to get there. One thing that amfAR has done that's been so important and that very few other organizations have done, and it should be said, done with quite modest resources, really, in the previous MSM initiative, was to provide support for capacity building for the community organizations, for the grassroots organizations that these folks have put together themselves. You know, some of the amfAR awards have been on the order of $10 or $12 or $20,000 for a year or two to get organizations going and be able to have phones and communicate. I mean, very, very basic kinds of support. That's enough for people to organize themselves, to inform themselves, to become part of regional communities, and to really start working as empowered community advocates. And that's just been invaluable because there hasn't been anybody else really funding in that space. If you don't have community partners on the ground who actually know where people are and how they're living and what their needs are, you know, you're operating in a vacuum. And of course, with these populations, you can't expect that the government is going to have a good handle on this, or necessarily healthcare providers. They may, you know, a very typical response, first response in a number of countries has been, well, we don't have those people in our country. We've done work in a number of countries that shows that discrimination in healthcare against men who have sex with men is a major barrier to people getting services. This is a global problem. We find high rates of HIV, particularly among young men and transgender persons in country after country. And almost invariably, those high rates are matched by low access to care. That's the double whammy.